Hello, my name is Dan Hoppy, and I'm the Executive Director of Academic Services and Professional Development and Training at Horry-Georgetown Technical College. This video was created for you, our students, in an effort to not only welcome you back to our campuses, but also assure you the health and safety of everyone is of the utmost importance to the college. On behalf of the HGTC community, we wish for you to have a healthy experience as you attend classes or utilize one of our on-campus services. Thank you in advance for watching this video, as it includes important information regarding COVID-19 and your safe return to our campuses. What is COVID-19? On February 11, 2020, the World Health Organization announced an official name for the disease that is causing the 2019 novel coronavirus outbreak, first identified in Wuhan, China. The new name of this disease is Coronavirus Disease 2019, abbreviated as COVID-19. In COVID-19, CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease that has not previously been seen in humans. How does the COVID-19 virus spread? The virus that causes COVID-19 is thought to spread mainly from person to person, and mainly through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another or within about 6 feet. COVID-19 seems to be spreading easily and sustainably in the community. In many affected geographic areas, community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. What are the symptoms of COVID-19? People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19, including cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. Children have similar symptoms to adults and generally have mild illness. This list is not all-inclusive. Other less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. How can I protect myself from COVID-19? At this time, there is no vaccine for the COVID-19 virus. So the goal is to avoid being exposed to the virus itself. Here are some ways that you can protect yourself from COVID-19.
Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public, for example, to the grocery store or to pick up other necessities. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Cover coughs and sneezes. If you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash immediately. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then use a household disinfectant. Most common EPA-registered household disinfectants will work. Monitor your health. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. This is especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet from others. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature. If symptoms do develop, follow the CDC guidelines listed at cdc.gov.
What are the health considerations before visiting campuses? Before returning to campus, please consider each question below. If you answer yes to any of these questions, please notify your faculty member, Student Affairs at 843-349-7550, and do not report to any campus, lab, clinical, or internship to minimize the possibility of spreading COVID-19. Have you been diagnosed with COVID-19? Have you been exposed to COVID-19? Have you been exposed to anyone who has been quarantined or in isolation due to COVID-19? Have you traveled internationally in the last 14 days? Have you traveled outside the immediate area by commercial air or other transportation and/or from areas where COVID-19 has spread? Have you had a fever, cough, difficulty breathing, loss of sense of smell, or loss of sense of taste during the last 14 days? Have you been around anyone who is ill with fever, cough, difficulty breathing, loss of sense of smell, or loss of sense of taste during the last 14 days? HGTC students who are experiencing any of the above-mentioned symptoms or other influenza-like illnesses are encouraged to call the Office of Student Affairs at 843-349-7550. We are here to support you. And thank you for watching this informational video regarding COVID-19.